This is Dr. Lorenz, Longevity Health Institute. So listen, serious conversation, got to talk about it, but we got to take cancer a little bit more serious. We got to really look at this and consider this because there's some real significant data out there. I want to share a study with you, like I shared on an Instagram post here. I promise you, I bring you this video, and it's a little bit more sombering and serious, but you really got to pay attention here, okay? Because not only is it in a study about cancer, but it's actually, I see it clinically in my practice. And just this week, I saw it twice with 2 new patients that are under the age of 50. So please listen to me, hear me out. It's a serious topic. It is dark or heavy, but it's to bring you the best in medicine and prevention, and I want that for you. So I want to share with you a study, okay? And I do believe at the end of this, I'll share what my thoughts are and what is suggested in the discussion of the study. But this is in the Lancet. So this is a peer-reviewed journal that just came out in July, okay? And I'm going to give you the cliff notes of it, okay? And I did take a few notes just so I could give the exact numbers, okay, and the data. But we are seeing an astronomical amount when compared to other decades and other generations of cancer, and particularly certain types of cancer, and particularly certain types of cancer in women. So it's all sexes, both sexes, but also a little bit more in some of these in women and younger women, okay? So I want to share this with you. So this study in Lancet, okay, has shown that in Gen X and Millennials, that cancer rates are up, sometimes as high as 3 times for 17 different types of cancer. Now there's particularly 5 types that are very high and very significant that I'll share with you. But again, this is a peer-reviewed journal, Lancet. This is brought on to you by the American Cancer Society. So this is not a holistic journal or some, kind of arbitrary, small journal. This is a traditional medical institution journal. This study actually was done by data collected from 2000 to 2019. So nearly 20 years of over 23 million individuals that were diagnosed with cancer and 7.3 million cancer deaths, okay? And when they looked at ages between 25 and 84 over these 20 years, there was a 2 to 3 times increase in rates of cancer when you were born after 1990, and especially when they compared to 1955, and even extraordinarily more so after 1920, okay? Now, there's a lot of reason to this. I'll kind of explain in the discussion of the journal article, it did this, but I want to further share this with you. When they looked at the 1990 data in comparison, there was a 12% increase just in ovarian cancer and a 169% increase higher in uterine cancer. That is crazy when compared to 1955. So we're seeing these astronomical rates in younger cancer in millennials, okay, in Gen X. I'm going to suggest as time goes on, this is not gonna actually exclude Gen Z, okay? So when you're born like 1965, 1980, and up, we think of these generations still as safe, and you don't have to screen as much for cancer. These people will be potentially in their, 30s to 50s, okay? So, but you gotta really, really, really be looking at this and considering this a lot closer. Now, the top numbers of cancer here were number 1 was uterine cancer was the highest, colorectal cancer was second, breast cancer, specifically estrogen receptor positive, gastric cancer, testicular cancer, and for some reason in women, liver cancer. Those are the highest ones, okay? Now, why was this? Well, one of the things in the study that they discussed and they came up with in all this data, again, of 23 million individuals that in that time frame, in those ages, okay, that were diagnosed with cancer, was excessive weight, obesity. So there was a big discussion about that and the inflammation effects and diet and our toxic world and foods and stuff. But weight was very correlated to cancer diagnosis and cancer death. So understand that we really got to get a hold of diet. We really got to get a hold of weight and really get at more an appropriate weight. And I think this really matches everything that's out there in the literature I talked to you about in longevity. And that is that the really biggest proven in science, in animal studies, mice studies, okay, which are the most reproducible and used, are that the only thing that extends life, the only thing proven is caloric restriction. And that is not argumentable. And is actually what's interesting is that's why you're seeing all these benefits of these GLP-1s, these peptides, that are helping insulin resistance and people lose weight because it's extending life. It's showing reductions, okay, in Alzheimer's and dementia. That's already out in studies, okay, and it's showing reductions in cardiovascular events by up to 30%. Why is that? Well, we got to get our weight in control, okay? Now, I'm going to tell you, this is a side note. It's not in the Lancet journal. So I'm going to tell you a side note and something that I see and I think that we have to consider COVID and COVID vaccines and the history, now that we're several years outside of COVID about the pandemic, okay? It has influenced our immune system, okay? It has hit and targeted our T cells, and we essentially are acting and behaving slightly like we're immune deficient, okay? Like we're HIV patients. Now, this is a big, drastic statement, but I will tell you that I see it in my practice when you follow the numbers and you dive deep and dig deep, people are behaving like they're immune deficient, okay? I'm seeing in the practice, I'm seeing new cancer patients in their 40s and 50s, and within 6 months of COVID, okay, they've gone from either a new diagnosis, a big new diagnosis that came out of nowhere, and they've done all the appropriate screening of cancer in their stage 3 or 4, or they went from a stage 1 or 2, and within 12 months, and in the middle, they had significant COVID, okay? Not hospitalized or anything, but they had significant COVID. Now they're stage 4, okay? And that was somebody I just saw today with breast cancer. The point being here is that it suppresses your immune response, so you cannot create a defense yourself. So we have to screen. We have to take cancer, looking at it as a metabolic chronic disease. And we cannot think of, well, I'm not old, whatever that is. I'm not 60, 70, 80, so I don't need to screen like that for cancer. We have to think of everybody, okay, as a potential cancer risk, just like we think of everybody as their cholesterol is elevating and potentially heart disease in your 50s or diabetes in your 40s or 50s or insulin resistance. We have to think it as a metabolic disease that we can get ahead of it, because early diagnosis is cure. Besides you then not having to go through hell, you got to get into an early diagnosis, stage 0 to 1 or 2, and definitely an early 2, okay? You will not only live, but you'll have to go through less hell, okay? Meaning treatment, okay? So early detection, early screening. I'm a huge fan of the Gallery test. You've seen my videos on this about early blood screening for cancer. We do cancer antigen markers here on all our patients and track those, okay, especially in the appropriate patients that have risks. But you cannot ignore this Lancet journal, this data from the American Cancer Society. It is real, it's legitimate. I am telling you, I'm seeing in the practice the last 2 years, and it's not slowing down. So my advice to you is, 1, get your doctor to do appropriate, okay, and deep dive cancer screening. 2, target your immune system. No matter how good you feel, look at your gut health, look at your diet, look in the mirror, because your waistline matters related to cancer. Okay, so you got to start working on diet and exercise and get that waistline down, okay? The other thing you have to do, though, is consider your stress response, which is part of your immune response, because two common denominators I see with everybody with cancer, unfortunately, is high stress, okay, whether it's physiologic, physical, or psychologic, okay, autonomic, meaning here, down, but it affects your immune system. And the other one is diet and gut health, okay? Now, I have to say this, and it breaks my heart, but also, we are drinking more in society, and alcohol, I do believe, now that we're drinking more and it's more common and more social, that is influencing, okay, our system and is influencing cancer rates, because alcohol consumption is up. So consider that too. Now do the right thing. Get screened, see a good deep dive practitioner that's going to spend time with you and listen. Do a personalized approach, like we do here at Longevity Health Institute, okay? Create a model for yourself and don't think of your numerical age, because who knows what your biologic age is inside and what's going on from an immune response. But you can get ahead of this, and good cancer screening will save lives and save burden, I promise you, and heartbreaks, okay? I see it, I live it every day. Please do that. Share this with others, loved ones, okay? We're here to always help. This is Dr. Lorenz. Be well.